Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com. Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and Medical Director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Okay, so we're just going to hang out today. And, you know, I just realized, so bold of me. We've had a lot of patients, and we really look forward to the programs where Doc and I can actually present a patient and where the person came from and what brought them into the office and what treatments have they had and how did they feel about it. Well, obviously, we have a guy today. First thing I did, I'm just going to keep record. How old is this guy? So I asked him, and he says, none of your business. I said, you know what? I'm glad you told me that because it isn't. That's very, very true. But to put things in a good perspective, here's a guy that we're going to talk about today that I guess, Doc, is just around the age where if something is not right, whether it's cosmetic or physical or mental or whatever, people are just saying, you know what, I'm not going to do this anymore. And that's what I think happened here.
Yeah, absolutely. And you know, the symptoms, like we talk about, you know, they come on slowly, and at some point, though, most people are going to recognize that something's going on, and then at that point, it becomes kind of an educational problem, and which is one of the reasons why we, you know, do this kind of stuff to you know, to try to inform people of the symptoms that may go along with vein problems,
yes, sure.
Venous insufficiency, because, you know, not all of the symptoms are intuitive. You know, if people have varicose veins, it's easy for them to say, oh, I've got a vein problem. But if they don't have varicose veins, they may just have swelling or, you know, skin discoloration or whatever, and they don't know that it has to do with vein disease. So you know, so it's kind of our job to get out there and to help people come to the realization that, gee, you know, those symptoms may be due to something that we call venous insufficiency, and the good news is that we can very easily fix that today.
Okay, and that brings us to introduce you to Jim, who joins us, and believe it or not, every single time that we've had the opportunity to talk with a patient, somebody out there says, "That's me." You know, that is exactly me. And I'm not sure about that. But first of all, Jim, thank you so much for agreeing to come down and be with us today. We appreciate you being willing to share your story. And from what I understand, in the few minutes that we've had to get to know each other already, you weren't a big vein problem guy. That you didn't, you know, have early symptoms as a young kid. What was it that finally made you think, you know what, I don't like this thing? What was the thing that had you go get looked at?
I had, after coming back from a run, one morning I saw an engorged vein on the back of my left knee, and I was afraid that was going to rupture, actually. Mm-hmm. And I had some problems 6 or 7 years before, and someone worked on my legs a little bit. And I had some other superficial veins, and I thought that I probably needed to have this looked at.
I really like it, Doc, because we say that a lot. But usually the guy says, okay, I'm going on to do the yard, Mom. I know you're listening to your vein show. It's really changed a lot, not only in your office when I see other patients, but this is kind of the quintessential example of somebody being aware. And I guess maybe if since you said it was at the end of a run, have you always run? Do you like running?
I've been, well, I don't want to tell you how many years I've run, but a long, long time. And it
started school?
Or after school? From college all the way through my Army career and police career.
Wow, runner.
Yeah, that's a good thing.
Can't run if you got bad legs, you know.
No.
And that's good. So maybe we'll have a chance to do some comparisons, running before and running after treatment.
Yeah. And you know, we hear that too, because people that become gradually more and more symptomatic from venous disease, they begin to stop doing the things that they want to, number one, which affects the quality of life, but also those things that they want to be able to do to maintain good health. And again, we hear that all the time where people say, gee, 2 years ago I was running 3 or 4 miles and without a problem, but now my legs are starting to feel like this and I can't go out anymore, or I don't feel like going to the gym. So it really can interfere with not only your leg health, but your general health.
How about this, Jim? I have a friend, I don't know if he's similar to you, but he's in his later 60s, way late, and he ran for an hour. He'd run for half an hour and then turn around and come back. And one day he got to the turnaround place and he couldn't run anymore. He couldn't walk. Called his wife to come get me. So, I mean, that would be a quality of life. I mean, so obviously whatever you did was to make sure that you could maintain your, I guess, I don't understand it, Doc. I don't love running. This guy loves running. But, was that part of it? Saying, hey, I don't want to give up what I like to do because this might be a result of it?
Oh, absolutely.
Wow.
And I could see myself slowing down. I didn't have a lot of pain, but I had leg cramping at night. And I was afraid that my running was going to stop.
Did you feel, or were you actually able to run less distance or less period of time, or were you able to maintain your running level, but still you were having to put up with these symptoms that were becoming inconvenient?
I think it was less distance and slower as well.
Just out of curiosity, because I've always, when it's nice enough to go running, I'm fishing. So, it's a little bit different exercise. But, I mean, what was it that got you into that in the first place? What told your mind, or what did you tell yourself? I'm a runner, and I'm going to always run. I like to run.
Oh, I applied for Army Airborne School, and you need to be in pretty good running condition to do that if you're going to have a good time.
At what age was that?
That's where I started.
Young guy?
I was 22 years old.
Okay.
So, did you run in high school?
Only because I had to for other sports. I did, but not very much.
It's one of the most reasonable sports, unless you have the real fancy shoes, right? What do you need? T-shirt, some Vaseline, some shoes. Go.
I mean, there's nothing better aerobically, for your cardiovascular system than running. It gets hard on your joints at some point. That's the only problem.
So that's what I was getting at. That's why I asked the question. The straw that broke the camel's back, or what made you go look? A swelling on the back of your leg.
Yes, exactly. Well, I had that swelling, and I hadn't really looked at my legs very much until I saw that, and then I looked at my right leg and saw swollen veins running across the front edge of my right leg as well. So I knew I had more than just one vein problem.
Well, that's great.
Now that was those were the symptoms and the findings that you had before the first time that you were treated.
No, this was the second time. The
more recently when you came to see us. Yeah. Okay. Were you back? And I think that you said that you had been treated maybe 6-7 years ago. And do you remember what kind of what led you to be treated back then? Similar kind of symptoms, or
I had visible symptoms, but I don't really remember anything other than some leg pain. Back then.
Yeah,
okay.
but Jim, you're like me. I think that you thought maybe, okay, it's sticking out there. What happens if it gets cut?
Exactly.
All the blood's going to come out.
Yeah.
I mean, that's a lot of people feel that way, I think.
Yeah. Well, and that can happen. Yeah. We see that periodically where people can have, spontaneous bleeding. Usually it happens a little further down on the, around the ankle where we have those very, very superficial dilated spider vein type, vessels. that the skin can become thinned over those vessels, and the typical story is that people are in the middle of a shower, and the skin's getting wet and whatever, and all of a sudden, boom, it lets loose, and it can look like a lot of blood coming out, especially in the shower.
Then people go running instead of, I learned the hard way. Put it up in the air, boom, it stops.
Yeah.
Yeah. But I think that's good. So it was a decision that you made at home, and you went on. What made you, you went to a clinic. You went to a clinic before here in Hawaii. I'm assuming all that was here in Hawaii.
Yes,
Yeah.
exactly. Yeah.
Okay, let's run through that.
So, then you had, we talked a little bit about your family history. I mean, when people come into the office, we got a whole bunch of questions that we ask them, but, one set of questions has to do with their family history, because if you have a family history, you're at a greater risk of developing, venous insufficiency yourself. But I believe that you said your mother's side of the family.
Well, that's why the veins that were engorged alarmed me, because I knew that on my mother's side of the family that almost everyone had varicose veins. So I knew it was partly genetic.
And how many of those relatives do you recall that may have been treated for their varicose veins?
I don't know how many actually were treated. I know that some went in under the old procedure where they strip the veins out,
right?
Which would discourage me from going in.
Yeah.
Thanks, Mom. My mom went through that, and it really soured me for a long time. I was in my late 60s before I did anything really.
Yeah, that has been the development of the way that we treat venous disease nowadays is one of the major attractions that I had for getting into the treatment of or the a practice of vein care. Back in those days, we were doing what we referred to as surgical vein stripping, which people went into the hospital. They were in the hospital 2 or 3 days. They had a bunch of incisions all over their legs, and it was pretty gruesome the way that we used to do it, and a lot of bruising, a lot of discomfort, and people were laid up for a week or so. But the things that we do today make it so much easier.
Yeah. Walk in, walk out. I love that, man.
And the procedure that we do now that took the place of surgical vein stripping is something that we call endovenous ablation, which you had several of those where we rather than pulling the vein out of the leg, the vein stays in, but we close it down, and it accomplishes the same thing, which is to eliminate that abnormal flow pattern that's happening in that abnormal vein. And your body reroutes the blood. So it's, again, it accomplishes the same thing. But, it takes, 30, 45 minutes, and you walk in and leave the office with a little dressing and your compression stock.
Hail the new stuff, Jim. I know that's what you're doing now, but even when you first started, it wasn't Stone Ages. I remember, like the vein stripping, I'm sure that some of your folks, your relatives had that like mine did. And in many respects, I was hesitant to get the treatment, but once I got it, if I could physically kick myself in I would, but I wasn't. So when did you have, first of all, the first diagnosis made, explained to you, and then what sort of treatment did you have?
The first clear diagnosis I had was when I went to see Dr. Juliff and his staff, and the sonogram, which Mike did, which was actually it was precise.
My hero, I love
excellent.
That guy. He's great.
It was just it was really excellent. It was far better than what I went through 6 or 7 years ago.
Okay.
It was more precise, and then the diagnosis immediately thereafter was pretty clear to me, and I was very impressed with that.
Yeah, when people come in for ultrasound, it is a very nice test, and we do so much with it, just as far as diagnosis and following people, and evaluating when they come back after their procedures, etc. But it's fun the way that we like to do it, which is to, kind of get the patient involved.
I love it. I love the sound, the splashing. I love all that stuff.
Yeah. And, the pictures, and because, when people see the images that are, displayed on the screen, and when Mike is pointing pointing things out to them, it really kind of makes sense. It really brings home the diagnosis. It brings home, the abnormality that we're dealing with. And that's a good place to start because, I think that patients, when they understand what's going on, the anxiety level is so much less. So
Okay,
hopefully that's what you experienced.
Yeah. So where are we in that? So to walk us through, that was more recently, right?
That was in May.
Okay. Well, it's brand new.
Actually, yeah. Well, the procedure was in May. The diagnosis and evaluation was in April.
Wow. Yeah. So that means obviously, and since then, I mean, I want to say, well, since you're at it, I got some problems in the left, in my left toe and all of that stuff. Are you being a little bit more investigative now?
I am. If I had any other issues, but now, I mean, this was really the only issue I was having.
That's pretty good, Doc.
What did cross my mind is that if the veins in my legs are not working very well, the valves are not holding the blood and where it should be, then that's probably making my heart work harder, and so that really rang a bell with me. I said, I probably need to do this to actually help my heart as well.
Doc, what comes to me though with Jim, and by the way, veinclinicsofhawaii.com is where you want to look at Jim. I mean, look at some other testimonials as well. Some of the procedure that's done is that it was a tool to allow him, like what you talk about, quality of life. Mm-hmm. I mean, if all of a sudden if you said, hey, Jim, I'm sorry I got bad news, but this condition needs a lot of work and you're not going to be able to do some things you used to do, you probably said, I'm not doing that because I love to do this. Okay, but the proof's in the pudding. You had a procedure. What if anything, did you notice? How long was it before you ran again? I mean, I want to know, how long did you not run? Mm-hmm. And then when you started running, did you think, is this going to be different? Is this going to be a more fun run? What was that like when you first got out again after the surgery?
Well, I mean, they really didn't put any constraints on me and wanted me to walk immediately, which I did. Yeah. The only reason why I waited any length of time, which was about a week or so before I went out to run, was I had stockings for a short period of time, and I didn't want the girls to see me wearing stockings.
We'll change, Doc. Yeah. We're going to change them on that. I'm wearing these things, and they are butt ugly, man, but I wear them every day.
So once I got out of the stockings, I immediately went out and ran, and it felt great, and it does too. I ran 5 miles this morning, and it felt really wonderful.
That's terrific.
So, which is one of the questions we get all the time is, when can I get back to activities? And really the only thing that we don't want people doing is straining with their upper body, actually.
With weight, you mean? You're talking.
Or heavy lifting. Or straining whatever way, but really people can use their legs and do whatever they're comfortable enough to do almost immediately. I mean, you could literally leave our office and go and run if you wanted to. Now we have some really fanatical kind of runners that they've waited until the next day. But do I kind of encourage people to do that? No, I think taking a few days off is probably the more rational way to do it.
And also there's another thing, Jim. I don't know how extensive it was. I know in my case, in one of the procedures I had was extensive, and it was like you have to come back and get checked tomorrow. I mean, so I mean, this is like, because it was like pretty major. In some respects, did you feel like you cut it off at the quick, that you took charge of it a little bit quicker?
Oh, absolutely.
Yeah, I think that's great. Yeah.
I had I had 6 procedures on my right leg, and that's not even the leg I went in for. But there were things that needed to be repaired. And then I had 2 procedures on my left leg. The one I went in for with the engorged vein in the back, which they calmed me down and said, "No, this is not going to rupture."
Hey, by the way, Doc, when that is, because I know a lot of us come in because of that, this big thing. What is that? What is that when that happens? When something looks like it's popping out?
Well, in Jim's case, it was a varicose vein. I mean, sometimes sometimes they can look a little unusual. Most people have fairly common kind of appearance to varicose veins. They're ropey and they're elevated, and they can be extensive. I mean, there's no question about that. You had fairly extensive varicose veins on your right leg, right?
Correct.
So, they're pretty easy to take care of, and I think that we eliminate them. Varicose veins, even though they're not the problem. I mean, there's an underlying problem with vein function of the deeper veins in the legs. So the varicose vein isn't in and of itself, the root problem, but still there are symptoms associated with a varicose vein, that throbbing kind of achiness and et cetera from that, dilated. And in the more activity you're doing, the more engorged that vein is becoming, and, it creates symptoms.
Well, what I think, Jim, is interesting in your case, that because I've, had the opportunity and the pleasure to, talk with a lot of our patients at the vein clinic, and that is that, it wasn't a symptom that was driving you, which means you must have, in many respects, a pretty high tolerance because of the things that you have done physically, that you must be able to tolerate some of the stress and strain, even attributable to running. How come at the end of the day, if I ran with you for 5 miles yesterday, I'd be at the hospital getting an IV, but so you can, that must mean that you have in the past endured, just lived with it, whatever it was.
I think you're exactly right. And some of the things, some of the aching and cramping and things that I had at night or during the day, I didn't really pay any attention to. Yeah. And I didn't really pay attention to it until...
Hook them up together?
Yeah. And then after my procedure, I noticed that they were gone.
Oh, geez. So, home run.
Wow. But I was in the Army for 20 years, and I was a paratrooper and did a lot of other things that
crazy young guy things.
Where you'd get tossed around and hurt and injured from time to time, and so you just kind of blow it off and get back to business. So
when you were treated the first time 6 years ago, presumably you were having similar kind of problems, and you got treated, and did that set of treatments eliminate, for the most part, the symptoms that you were having back then, and then they returned, or what was the timeline with all of that?
I think it did eliminate
most of
those symptoms, and then they returned. And like I said, I noticed the superficial veins first before I realized that there was a deeper. No pun intended, a deeper problem than I had. So yes, and 6 or 7 years ago, the procedure was not nearly as precise and exact as what you and your team did. It was almost as if they were fishing around to decide exactly what to do, as opposed to you and your staff and who just went immediately to the problem and
and you know what, I guess, Doc, that's a compliment, and I have a similar one, Jim, and that is, even though I do the show and Doc and I know each other, and I go into the office, it's here's the iPad, answer all these questions, and there's a lot, but I do know that when that gets put in your hand, because I can't blame you for not remembering every procedure on every patient, because that's just not possible. But once you have these records, and that's why what you said to me, and I want our listeners to understand it, when you have that ultrasound, that's in history. And then a year later, when you come in to get another checkup, there's where you were and here's where you are. Isn't that, Doc, when a lot of things and this is coming back, or that's okay, and I'm glad you're coming here because we got to do a little work on this one because.
Right, yeah. I think, follow-up is very, very important, especially in, venous disease. which is what we didn't do very well before, in the old days when we were doing surgical vein stripping. I mean, people came into the hospital, they had their operation, and it was like, see you later.
I don't want to ever see you again, man. Thank you very much. See ya. Yeah.
But, I think to really do a good job treating, chronic venous insufficiency, you really need that follow-up because, again, it's a genetic thing. It's an inherited kind of problem. We're not changing your genes in doing what we do. We're just treating whatever problem you have at the time. We've got in the habit of doing what we refer to as surveillance ultrasounds. After we treat people, surveillance ultrasounds, either 6 months or 12 months. We can, in doing that, it really should minimize the things that you might need in the future because we're going to be catching things early, doing things in a little simpler sort of fashion, and you shouldn't ever have to go through all of the things that you've gone through already. If we do our follow up properly.
Yeah, I think that's good. I mean, I don't know if you had that before, but I would imagine. And what's kind of interesting to me about Jim is this is a very recent procedure. So it's obviously fresh on his mind and yours.
Sure. Yeah. And getting back to the ultrasound, the thing that has always appealed to me, just taking care of vascular issues in general, not only vein problems, but, back when I was in the hospital doing arterial and heart things, we should always, we are able to have a very precise diagnosis, if we do the ultrasound and the angiograms and all that sort of stuff. That has always appealed to me. But I'm glad that you appreciated that. The fact that it seemed like we had kind of a plan set in place by the time you got there, because and that's the way it should be. I mean, we try to do that for everybody. We try to diagnose people completely and to have a very good idea about what we're going to accomplish to get them to where they need to get to.
Okay, I got a question for you, Jim, and that is outside of this instance with this bulbous vein in the back of your leg, what about other health things? Because we look for these like comorbidities or whatever you want to call them. What other things, if any, health issues have you had? Because it doesn't seem like with all of the physical stuff you've done, you couldn't have had too many because otherwise you couldn't have done all that stuff.
No.
General health.
Yeah, my general health is excellent. Mm-hmm. So that being said, this was a little frustrating.
I bet.
Finding out that, I had, veins in my legs that weren't cooperating. And I wasn't 25 anymore.
And there's no pills.
Yeah,
right?
There's no pills.
There's
no pills. And I'm a paddy dive master too. So people see my legs when I'm on the boat. Yeah. And that's a little embarrassing. But
I knew we had something in common because I'm both Naui and Patty. Oh, so we got and honestly, that's when you're weightless and legless and painless when you're in the water. But I mean, then there's sinuses and there's all the other things that can happen. That must mean that outside of the issues that you went through with the veins, that your health is, thank goodness, your immune system must be pretty good.
Sure.
Yeah.
Sure.
Getting back to your symptoms, you said something before that kind of caught my ear, and that is that you didn't or you didn't appreciate the symptoms that were relieved until after the fact. And that's something that we hear all the time, because again, the symptoms come on very slowly, in venous disease and over a very long period of time. So I think it's very easy, especially someone like Jim, who has endured, physical adversity.
But it was his choice. I mean, these are all choices you made. I mean, you didn't have to keep upping and reciting, but you did. Yeah, because you could.
Yeah. So, I think it's easy for a lot of people to ignore symptoms or just live with them. Mm-hmm. So, the thing that we hear all the time is, people come in and they'll sort of minimize their symptoms, and then afterward they say, "Gee, Doc, I didn't really appreciate how bad my legs felt because now after having all this fixed, they feel great." So will you comment on that a little bit?
Well, my father's side of the family, people they ignore pain and issues, and until they drop dead of a heart attack in the kitchen,
sure.
and they go to the hospital, and then 2 weeks later, they're gone. So that's sort of a family history, and my military history. You put it out of your mind, and you like my father used to say, if you're in pain, just gut it out.
Yeah, it's the mission.
Yeah. So
Yikes.
with respect to what were the symptoms that you didn't really fully appreciate beforehand that you then realized were relieved after you had procedures?
Oh, the cramping in my lower legs. I also had some aching, and I didn't pay very much attention to that.
Yeah.
I said, I'm getting a little older,
Yeah.
and now those are gone, and of course my legs look a lot better, if I say so myself.
Most importantly.
Absolutely. No, listen, we talk about that a lot. When we look at spider veins and cosmetic surgery, a lot of the women it's 50-50. I mean, men are the same way, and particularly here in Hawaii, because we are outdoors like all the time, and
right.
like you, Jim, you're on the boat, shorts. You're not wearing your flannels and your big socks for people. These are my legs.
Yeah.
But that's interesting, because it sounds to me like, when you're in when you're in the Army, it's mission. Forget the health. You got to do this today.
Exactly.
Yeah.
Wow.
And I think that, with respect to, how your legs look, I think you're right. I mean, everybody wants, their body to look good, and legs too. But it's becoming more and more acceptable for men to be able to, admit that, hey, listen, I want my legs to look good, you know.
You bet.
So, that's easy for women to come in and say, hey, that's one of my goals is to, I want my legs to feel better, but I also want them to look better.
Yeah.
So we're having more and more men come in and get fixed to improve, the way their legs look. In some, there's a good number of men that come in who they're coming in for, specifically for cosmetic reasons, to have spider vein injections or whatever, and that's great.
Okay, we were talking in a recent show we did, and Doc and I talk about this all the time, Jim. Did you do any web surfing? Did you get on the internet at all to say, what is this? Maybe on a Friday night when there is no doctor, no emergency room, it's not an emergency. Did you ever go click to see what might be wrong with you?
I did, yes.
Yeah.
And I
What'd you
looked.
find?
What really hit me the most is that procedures between 6 or 7 years ago, when I first had some work done on my legs, and procedures now are significantly more advanced.
Yeah.
And the technology is better, and of course a lot of that is due to Dr. Juliff and his staff and the way they do things. But I knew what the possibilities were going to be by the time I went in to see him, and so
I'm glad he said that, Doc, because I have not been able to put it in quite those words. What I'm impressed with all the time there is the fact that you always are on the cutting edge of looking into the new procedures, whether it be a wire or a catheter, all of these things. When trying to explain this over the radio, gang, is really impossible. That's why you got to go to veinclinicsofhawaii.com, and see some of this stuff. Because if people could only know, when you ask Jim and me, did they run that catheter up your vein? What do you mean? I don't want to know that. I want to go to sleep. But isn't it amazing what a patient like him or me will notice in the office? I always ask Jim, hey, what is all that? What? Oh, that's a catheter. What does it do? It goes up in your vein. Really? That little thing goes up in my vein? And then all of a sudden you're saying, okay, get up, you're done.
Well, I felt nothing.
Yeah, I
felt no pain.
Yeah.
It was I talked throughout the procedure, much to probably Dr. Juliff's chagrin, and asked him, where he was in the vein and blah blah blah. And there was no pain. Even the surface veins where they did veinectomies to remove those, I didn't. I felt a little bit of pressure, and that was it. It was so.
Yeah, and Doc, maybe you can explain that, because I do know that you use a topical, sort of nerve killer, like I won't say Novocaine, but a topical thing, and then so when it does time to make the little incisions of the little holes, you don't feel it.
That's exactly what we use. We use a medication very, very similar to Novocaine. Novocaine is, I think most people recognize that as the numbing medication that dentists use. But we use a medication called lidocaine, which is, like I said, very, very similar. But we use a technique called tumescent anesthesia. It's still a local anesthetic. It's still, basically numbing medication. But we use a very kind of dilute solution of lidocaine and a couple of other things. But we then we inject that numbing fluid into the skin and immediately under the skin. And that's a technique that actually was developed 20 years ago when liposuction was becoming very popular. And, before, at some point, there was a transition very similar to vein disease when liposuction was kind of transitioned from in-hospital, in-operating room, general anesthetic kind of procedure to more of an outpatient, patients awake. And it's so much more, it's so much safer for the patient to have that kind of anesthesia, local anesthesia as opposed to general anesthesia. So as the vein world, as the modern vein world was developing, we sort of incorporated that tumescent anesthesia technique into the things we do, and yeah, I mean it has always amazed me the amount of things that we can do to people and the extensiveness of the procedures that we do. And again, it's in an office setting and it's with basically a local anesthetic. But we can keep things very, very comfortable for people.
Here's the thing, though, Jim. I got to get a kick out of this part of it because, not only in days of past, if you'd had a big issue with a problem, you go get it fixed and then hush up. I've not been able to keep my mouth quiet because now I'm more observant when I see, like in a friend or something. I had one of those. That's a vein. You better have somebody look at that little rascal because I had one of those. And I wasn't trying to pump you whether you've done that or not, but have you been willing to and to share? Because I know that just in probably the social circles you hang out in, you're also with other active people. And they might all need a little ultrasound and a little poke here and there.
Oh, I show everybody my legs now.
I love that.
And,
That's great.
And I have a couple of neighbors. One who actually went down for the first consultation with Dr. Julia's staff, Korean girl, and she had the veins, superficial veins, in her lower leg, and I'm still working on her to get her in. She's a little scared, but
what's interesting, and Doc and I have talked about this before, it's the number of professionals who are not able to work as often, like whether they're a cosmetologist or a barber or a dentist or a vein doctor or whoever. I mean that actually suffer, maybe not socially, but suffer financially because they just don't get treated.
Mm-hmm. Yeah, there's and I think the anxiety. People do have a fair amount of anxiety with respect to coming in and being treated, and again, that's another reason why we do this kind of stuff to try to get the information out to people that they don't have to be scared, and people can come in. I mean I encourage people. Just individuals or family members. A lot of times we hear somebody say, "Oh yeah, well, gee, my sister has terrible veins, but she's so afraid to come in." And I say, "Hey, just have her come in. We will talk to her. We can do an ultrasound if that's what she wants, because that's completely painless. And then we can give her the options. It's not like we're going to tie anybody down and make them get treated, but at least come in and find out what the options are. But again, we have the techniques now that we can literally keep pretty much everybody extremely comfortable. And it really is not a problem.
Well, I like the fireside chat, Jim. I like the fact that when the questions have been asked and the ultrasound has been done and you've had, taken a look at it. Okay, now you sit down with Doc, or you sit down and say, okay, great. What's the plan? I mean, now that we've got this, so I want to find out what that was like for you, because obviously a short time after you went into Vein Clinics of Hawaii, you said, okay, I'm thinking this is the right place. From what point in time, what did it take from that day, the first time, to when you had your procedure? How long? A couple of months, it looks like.
No, it was about a month.
Yeah, that's pretty quick. Yeah.
Dr. Juliff, I think, was off island, so as soon as he came back, I went in. I had 6 procedures in a row. Wow. And 6 days in a row, and I mean, it was just precise. And I wanted to add, because you talk about anxiety, but the staff there is they're really good at distracting you. And so, you know,
a little pinch here.
My best distractor was Mary Jean, and you know, she and I'd be talking, and all of a sudden, you know, they'd say, "Okay, you're done." I say, "What? We're done."
Wait a minute. Show me.
So his staff is excellent. They do that very, very, very well.
Yeah, and Doc, you know, look, it's no mistake. I mean, to be able to have the 4 clinics and to be able to do that, and you said quite often it's the people, and that there's a comfort zone that everybody every patient has some staffer or other that they align with and they share stuff with. Yeah. And it must really make it easier when you finally got to sit down with Jim, who he'd already talked with, and you said, "Okay, Jim, well, here's the deal. Here's what you got. Here's how we can aggressively go after this. Here's something we watch on the back burner." Talk about that for a little bit, how that works.
Yeah, right. Well, we once we have that whole evaluation done and we've done the ultrasound, then it's time to kind of go over things. And you know, I like to go over things pretty specifically. As a matter of fact, you know, you were mentioning you know, catheters up veins and that kind of thing, and you know, we talk about that sort of stuff, and you know, every now and then, you know, somebody will say, "Well, you don't have to go into all that. I really don't want to listen to."
But Jim, but wait, Jim, in your case, I mean, I was so inquisitive. I'm so blown away by gadgets and new things. I thought, I can't believe how medicine has changed to the point where you can get an injection and the needle is so small and it's so sharp you don't feel it. I'm signing up for that, because a long time ago, I had some painful procedures, almost putting me off to not want to go back again.
Well, like I said, I felt no pain, even the anesthesia, you know, to start the process off. I didn't even feel that.
You know, with respect to the devices that we have, you know, one of the really fun things about, you know, practicing vein care nowadays is the fact that, you know, there really are new things being developed all the time. You know, there's, you know, most surgical subspecialties, you know, they've kind of developed to a point that is good. I mean, you know, but it's not like there's a tremendous amount of new things happening. But in the vein world, there really has been over the past 10 years, and it's fun, using the devices and also being able to have an array of things that we can do that are the best thing in any one specific situation. And it allows us to treat people so much more completely than we ever did before.
You know what we forgot to ask you, Jim, earlier, and it's kind of me. Had you been, at any time prior to you getting the surgery and getting corrected, because you were saying that it wasn't a matter of pain at all, because you're a pain guy, pain, whatever. But when you finally got decided to do this, then you found out later that wait a minute, some of the pain was from this. I just didn't know it was from this. So like you said, leg cramps. Did you ever wake up in the middle of the night with your legs in a cramp?
I did. Yes.
Yeah, I hate that.
Yeah. I thought, well, maybe I'm dehydrated, or
me too. That's what everybody thinks, right?
And that was not the case. Yeah. It was, but I really wanted to get. I really wanted to go through the process and improve my the veins in my legs, because I felt like that if I didn't do that, then I would have worse problems down the road.
In many respects, Doc, I think that most, I don't want to say most, but a lot of patients don't realize that till it's almost like, why didn't you come in earlier, man? You're a project. You could have been an easy one.
Yeah.
Not the gym is necessarily an easy one, but obviously, I mean, there is a way to explain what he had and treat it and have him get the results that he should. He got. Yeah.
Mm-hmm. Right. There's a lot of people who do way too long. There's no question about that. And yeah, they're doing themselves a little bit of a disservice because vein disease, we say that it's a progressive kind of problem. You can't exercise more, you can't run more, you can't change your diet and do whatever and alter the course of chronic venous insufficiency. It's just going to get worse with time, and it's a mechanical problem, and it needs a mechanical fix. So some people let it go too long, and then the job is a fair bit bigger, but we usually get through it and handle it fairly well, and they feel good.
Yeah, I like that in a lot of different respects, because I think that we should touch upon this. A lot of times, Jim, what you said, that this vein was the trigger that you saw something, but in the meantime, Doc, I do know that there are certain things before you do procedures that insurance-wise have to be sort of explained so that you apply for the insurance coverage. Yeah. And so out of curiosity, if Jim says, no, I don't have any pain, I just think I'm worried about this thing. Mm-hmm. How do you treat conditions like that so that they are approved by insurance companies?
Well, we do have to have symptoms to treat from a medical standpoint. In order to treat the disease, we do want the patient to have symptoms, and by and large, people do. And again, Jim was probably not really appreciating all of the symptoms that he was having, which I think became evident afterward.
Later, after the procedure,
So we document the problems that we see, and typically that's going to cover the insurance kind of mandates. But getting back to the amount of time, Jim came in and we were able to treat him relatively quickly. But the reason we were able to do that is because he had been treated before,
exactly, the history,
and he had been engaged in doing the what we call conservative measures. When we see people who have not been treated before and have not worn stockings and done those types of things, typically Medicare and some of the insurance, all of the insurance companies want us to treat people conservatively for 8 to 12 weeks, depending on which company it is. So there's those criteria too. So we have to treat people conservatively for 2 to 3 months, and basically what they're saying is that they want us to prove to them that wearing stockings and elevating your legs and taking anti-inflammatories or whatever is not going to be enough to treat that particular patient. Mm-hmm. Well, typically it's never enough because it's a Band-Aid. It's not going to fix the problem. It may help the symptoms, but the symptoms are only being helped as long as you're wearing stockings, and nobody's going to wear stockings every hour of the day.
Jim, you did say you didn't want to get on that boat with those stockings. I can't say as I blame you.
I didn't. What I did do was before I went down to see Dr. Juliff, I put stockings on and wore them because I knew somebody was going to ask me if I'd tried that. And,
good for you.
And so I did it. I did it. So.
Yeah, and there's another thing now, and I guess we can chalk this up to opportunity. I see now that there are a lot of companies in sports enhancing stockings are common. Yeah, and it's not necessarily for varicose veins or venous insufficiency. It's for healthy blood flow and endurance.
Yeah.
Go figure.
Yeah. There are some of those leg compression devices that aren't meant for venous disease, but they're meant for muscle recovery, and there's some science behind that. So
and interestingly enough, so I guess you did wear it for a period. Yes. Before the operation. Do you wear them occasionally anymore?
No.
Yeah.
I maybe I should, but I don't. My legs look really good and feel really good.
Yeah.
I don't feel the need to wear them.
But yet I just saw a little tally mark go down to Dr. Juliff in his mind.
That's a demerit point, Jim.
I'm sorry.
But I'm telling you, it is pretty interesting. And depending on as you age, some of this can be a little bit more difficult, but there is every reason now, particularly when we take a look at it's opportune to have Jim with us today, because we're in the middle of something in this world that we've never faced before. And there are a lot of concerns that there are certain other parts of your body that do get affected by this pandemic. So obviously everybody has that concern. What about people that, you went into the office to get treated right in the middle of all this stuff?
I did.
Yeah.
And I was, I didn't know what was going to happen.
Yeah.
I didn't know how long I would have to wait. And fortunately I did not have to wait. So.
Yeah, Doc, you might explain that. I mean, there are some things I guess you can hopscotch, particularly if there's a record, like in Jim's case, he had gone several years before for some treatment.
Yeah.
He maybe could have gone back and had re-up, but he didn't. But when he finally did, now this starts off a whole new acceptance level for him, right? If he comes in 6 months or a year for a checkup, assuming he didn't have to do anything more right this minute, that it's easy to say, okay, well, it's time for another procedure, not on what we did, about what's cropped up in the past. But that doesn't mean that it's going to be very quickly, does it?
No, not at all, or ever. I mean, we may
Knock on
never,
wood, ouch.
we may never have to do another thing to Jim. But other than to just kind of keep track of him and do ultrasounds periodically, make sure everything's ship shape. I just wanted to make a comment with respect to stocking use, and that is that I encourage pretty much all of our patients to get used to wearing compression stockings, and they don't have to be the high one, the thigh high. They can be just knee high stockings.
Yeah, those are mine, knee high.
Yeah. And I think it's because again it's a genetic thing. We haven't changed that, so the propensity for you to have vein issues in the future is still there. And one of the ways that you can minimize your risk of developing other things in the future is to, wear compression stockings. And
here in Hawaii, it's a hard sell, though, Jim. Don't worry, you're not alone.
Yeah, well, it's hard.
I will consider it. Please don't
seriously.
come over to my house to check.
Yeah. Okay, I'm the stock. I'm the. And you know what? There's another thing. They're not stockings. They're actually garments. But since they look and feel like socks, it's, what am I paying $30 for a pair of socks? That's not going to happen. But by the same token, really, I mean, look at it, and I want to tell you that I've developed a method to get them on. And if I can't, anybody can.
You're good.
Yeah,
You're good
I'm really good at that. But I still think that there are socks and there's socks. Now, I think some docs want you to wear these big old things that like feel you're in a vice. But the ones that I have from you now, they are compression, no question.
Oh, yeah.
But they don't leave big welts and they don't dig because they're not the highest level of compression.
Yeah. Yeah, well,
some people need that, though, right?
And that's the balance that you have to kind of look for, because if you make the stocking too uncomfortable, people aren't going to wear it.
Just not going to do it. Yeah.
But we use a moderate kind of compression level, and what I was going to say before, Jim, is even if for people who have gone through treatment, etc., even if they wear knee-high stockings just at work, and especially if they're in a job where they're on their feet all day long, there's no question about that. Those people should definitely be wearing compression stockings. And if you do it kind of consistently, do you have to wear them every day of the week? No, but on those days,
I do.
Yeah, well, yeah.
But wait, I'm interested in another thing. I mean, let's talk about performance enhancement for a minute. Since, Doc, some of these bicyclists and some of these long, track and field guys are wearing these socks, these compression garments. So obviously, Jim's a runner, and so I would be interested in saying, is it recommended that you wear compression stuff when you're running?
It from a venous standpoint, not necessarily. I think that it's probably more important to wear compression stockings if you have venous issues when you're not exercising but standing in one position when all that blood has a tendency to,
because when you're moving, I'm guessing you got great circulation going.
Yeah,
moving,
when there's muscular activity going on, that muscular activity enhances vein blood flow, so it's not as important. Now I will say that it would be interesting to see if they have something called sleeves, and which are designed for physical activity. It's not a full. It doesn't go over your foot. It kind of goes from your ankle to your knee, but it gives you a little bit of compression on the calf muscle, and those are the devices that are said to be advantageous for muscle recovery. So for someone like yourself, Jim, it might be interesting to see, especially since you continue to run at a fairly high level, would wearing a sleeve be beneficial for your running? It'd be an interesting question.
Well, I can tell you one thing, Jim. Once again, I want to tell you how much I appreciate, on behalf of our audience and Doc and the staff, of you sharing your experience with us, because everybody needs a little bit of an nudge now and then. It looks like you've done yours, and knock on wood, it'll be like that for a long time. You think?
Well, I thank you for giving me the opportunity, because I'm definitely improved, and I knew I had issues. I didn't know they were as bad as they were, but now I feel a little more confident.
I can't think of a better way to end. Jim, thanks very much for joining us.
Yeah, thank you, Jim.
We'll see you next time. And gang, if you want to know more, you go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com, and get yourself checked out. You might be just like Jim. If you want to run, you can run and have more fun while you're at it. Thanks for listening. See you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.